Hi, Danielle M. Bryant here. So in this video I want to just have a closer look at biological handedness or laterality, as this is really important in GNM or German New Medicine. First of all, we need to determine our biological handedness, as this is not necessarily whether we write with our right or left hand. Biological handedness is our laterality on a subconscious level, and this is very important as it determines where conflict shocks and biological programs will impact, and I will come back to that in a moment. Dr. Harmer actually stated that biological left-handedness was a lot more common than we think, and it's more like 48% of us are actually biologically left-handed, whereas it is commonly seen as much less. And the reason why many left-handers write with their right hand or think that they're right-handed is because that they're taught to write with their right hand. Some are even forced to, but it could also be just that the parents out of habit handed them pencils and cutlery and things like that with their into their right hand, and they just become accustomed to writing with their right. My daughter is actually left-handed biologically, but she writes with her left hand. And as Lloyd and I homeschooled her from about age 11, we always had trouble getting her to write neatly. And this could actually explain why. Also, whenever we ask her to lay the table, she puts the knives and the forks the wrong way round. Well, for us anyway, because we're right-handed. So maybe little signs like this could hint that you may be left-handed. So the easiest way to determine your biological handedness is to clap. So let's try clapping and then stop and look down. So the hand that is on top or has been the most dominant is your biological handedness. So my right hand is on top, so I'm right-handed. And to confirm this, you could try swapping over and clapping with the other hand, and that really sort of feels a bit strange to me, so I'm definitely right-handed. Now, if you were to clap straight like this, and I have seen people do that, and you really can't tell, then you could try walking forward and see which foot that you step forward with. Or you could try getting somebody to throw you a ball and see which hand you catch it with, or tap a balloon and see which hand you tap the balloon back with, and see which one feels the most comfortable. The important thing to do, though, is to do these things without thinking, as we need to assess the biological handedness on the subconscious level, like I previously said. So the reason that this is actually so important in GNM is that it determines where the DHS will impact on all brain layers except for the brainstem, because the brainstem developed before we had a right and left side. So all of the brain layers will have this laterality rule. We have a subconscious association with anything to do with nurturing and caring on our non-dominant side. And this is because we carry and nurse children with our non-dominant side, so as our dominant hand is free to do things. And I'm sure if any of you are mums or nans, that you've had a child on your hip and you've been cooking or doing something else with your dominant hand, so that it shows how we have this really strong connection with our nurturing side and our non-dominant side. So for a right-handed person, the left side would be associated with the mother, the children, the nest itself, or anyone we care for or nurture, or who has been very involved in our care and upbringing. So this could also be a grandparent if they were extremely involved in your upbringing, a pet that you mother, an elderly relative that you maybe care for and mother, or who mothered you, even a client or patient or a pupil if you're a teacher. If you really have that strong bond, that really strong nurturing bond, then somebody else outside of the maternal line could move over into this maternal side. The nest is actually what we would perceive to be our nest, our family home. So anything or anyone else would affect the right side of a right-handed person. and this is commonly termed as the partner side. So in GNM, it's the mother-child side or the partner side in short. And this could relate to a sibling, a friend, a colleague, a neighbour, and also actually our father is considered to be our first partner. Although if he was primarily involved in your upbringing, so for example, if mum went to work and dad stayed at home, or if we were brought up in a single parent family, then the father could move over to the maternal side as well. So the opposite is true for left-handers, the left side being partner and the right being mother-child. So when there is a DHS that causes a tumour or any other symptom, not only can we identify the conflict theme, which can be determined through assessing our symptoms and the part of our body affected to see which biological program we are experiencing, but we can also determine who or what this DHS concerns by the location it occurs in, such as if it is on the right or left side. And I will look at that in another video. So I really hope this has helped you to understand biological handedness and its role in GNM. Thanks for watching.